Millions on Medicaid are at risk of losing coverage in the months ahead. Find out why. Medicaid benefits when the pandemic health emergency ends. Some might sign up for different insurance. Many others are bound to get lost in the transition. State Medicaid agencies for months have been preparing for the end of a federal mandate that anyone enrolled in Medicaid cannot lose coverage during the pandemic. Before the public health crisis, states regularly reviewed whether people still qualified for the safety net program, based on their income or perhaps their age or disability status. While those routines have been suspended for the past 2 years, enrollment climbed to record highs. As of July, 76.7 million people, or nearly 1 in 4 Americans, were enrolled, according to the Centers for Medicare and Medicaid Services. When the public health emergency ends, state Medicaid officials face a huge job of reevaluating each person's eligibility and connecting with people whose jobs, income, and housing might have been upended in the pandemic. People could lose their coverage if they earn too much or don't provide the information their state needs to verify their income or residency. More marginalized people. Low-income people could still be in crisis when the public health emergency ends, said Stephanie Burdick, a Medicaid enrollee in Utah who advocates on behalf of patients with traumatic brain injuries. In general, being uninsured can limit access to medical care. COVID vaccination rates among Medicaid enrollees are lower than those of the general population in multiple states. That puts them at higher risk for severe disease if they get infected and for exorbitant medical bills if they lose their insurance. They're more marginalized people, Burdick said. She said she worries that they're going to fall off, and that they're going to be more excluded from the healthcare system in general and just be less likely to get care. No end in sight. Some people argue the current protections have been in place long enough. There's no end in sight. For 2 years, it's still a quote-unquote emergency, said Stuart Whitson, a senior fellow with the Foundation for Government Accountability. The conservative think tank has argued that states can legally begin trimming people from Medicaid rolls without jeopardizing their funding. This is the kind of problem that just grows worse every day, he said of not removing ineligible people. At the beginning of the pandemic, people were in a different position than they are now. And so responsible legislators and government officials in each state have to look at the facts as they are now.